The Windsor-Essex Children's Aid Society is in crisis, facing a $10 million deficit that's forcing tough decisions. Demand for services is at an all-time high, with more children needing complex care. Some parents are even surrendering their own children to CAS because they can't manage their needs, something the organization says isn't within its mandate. At times, up to 15 kids are in unlicensed placements like hotels and office buildings, requiring 24/7 care. Staff say some of these cases involve violent behaviors, creating safety concerns. Ontario's ombudsman is now investigating these unlicensed placements and the government's response to them. With costs soaring and no relief in sight, CAS has had to lay off 25 union employees, and they'll be laying off up to 7 management staff. Executives say this all points to a broken system, one the province isn't addressing. Derek Droulard is the executive director of Windsor-Essex CAS. He joins us now to explain these cuts and the ongoing crisis. Good morning, Derek. Thanks for coming in.
Good morning. Thanks for having me, Amy.
Help us understand why the deficit is so high.
Yeah, our deficit is primarily driven by those costs associated with caring for complex children and youth, both in our care and in the community. And so as those situations, you and I have talked about them over the last couple of years, we've been ringing the alarm bells about the crisis around this, mostly vis-a-vis the impacts it has on children, youth, and families, which has been horrific. But those costs have been mounting on our agency for 2 to 3 years now. And as those costs have continually not gone away because the system continues to be broken in how it responds to children, youth with complex needs, we've had to absorb all of those additional costs out of our core budget. As a result, that's been eating away at our core budget and putting us in a negative deficit situation. So at this point in time, the deficit, $10 million, just over $10 million over 2 years, $3 million and change last year, another $7 million this year. As that has grown, we've been left with the unenviable and really excruciating decisions to reduce our workforce, to adjust so that we can become sustainable and balance our budget over the next 3 years.
How much of the budget goes towards children in unlicensed placements?
This past year, we've spent over $6 million supporting children, youth, and unlicensed placements. So if our budget's deficit's just creeping over $7 million this year, you could see a good majority of that budget is tied into supporting those children and youth.
Have funding levels changed at all, or is this a case of growing demand?
It's a case of growing demand. The government does a good job in pointing out that our volumes have dropped in the sector, so therefore our costs should be down. And I wish it were that simple. The children and youth that come into our care are considerably more complex and require higher levels of support and services than ever before. And so while the volumes have dropped in that regard, those particular children, the percentage of those children in our care are small. They account for over 68% of the boarding rate cost. And so they are a small group of kids that cost a tremendous amount of dollars to support, but they're kids that require that level of support.
How many people are in unlicensed facilities right now in Windsor-Essex?
Right now, we have 9 children and youth in unlicensed placements in our community.
And their age range?
Youngest would be 7 to 8, and generally speaking, we're seeing most of these youth at the ages to 13 to 16. That seems to be the area of youth that we're most concentrated on, and the youth that are presenting with the highest acuity and challenges. Many more autistic and children living with autism and developmental concerns that are demonstrated through these really challenging behaviors.
And a lot of those teenagers and children are brought into your care because parents are surrendering them. Is that still the case?
Yes. We have a number of families in our community that are so desperate to get the kind of support and services for their children and youth, and at the same time trying to maintain them by themselves in their home, maybe with younger siblings in the home. They've reached the point where it's no longer tenable for them to care for their own children. They come to the system in hopes that the system can respond positively and give their children a better future and support them in a better way. And sadly, they're let down time and again.
I can't imagine being a parent in that situation where I think my child is better off being in a hotel by themselves, monitored 24/7, than being under my care. That to me says desperate times, but it also says that the system might be broken, that this isn't necessarily the answer.
Yes, you're absolutely right, and we have those active cases happening right now that we're trying to manage, where families are making these excruciating decisions, and the hopes of getting better service, and certainly the criticisms come back to children's aid societies. Why aren't you finding better placements? Why aren't you? We hear that often from our ministry, but this is really I don't know who in government is the architect to fix this, but we've been pleading with government to come up with solutions, come to the tables, come to the communities with us, and help us build a system that doesn't place children and youth at further risk, and also that doesn't require families to have to give up custody of their children.
22 union or 25 union employees, up to 7 management. You have workers who are getting burnt out, who are being required 24/7, and you're cutting staff.
Yes.
What's that look like?
Yeah, it is really us mobilizing ourselves in a different way and utilizing our staff in a different way. And so we are committed to continuing to offer the services that the community is accustomed to in terms of ensuring that children and youth that we serve get the best service possible. This won't be easy. The span of control for work and having our staff rally around each other to support these children and youth is going to be key. We will continue to adjust our service delivery model accordingly.
Yeah, how's this going to affect the quality of care?
We're committed to ensure that it doesn't affect the quality of care, but it's not going to be at zero cost. It's going to be a cost to our staff in the community in terms of how we wrap around these families. So there are instances where I think we're going to see ourselves really struggling and reaching out to the community for additional supports.
Are these frontline workers?
Yeah, by and large, frontline workers, dedicated, good people who have contributed positively to the agency's mission and vision and the community. So it's a real tragic situation that we're facing right now, that they've had to be laid off from our organization.
Now, we know the Ombudsman is investigating unlicensed placements, the provincial government's response to that. What do you hope comes from this investigation?
I hope it highlights the cracks, fractures, and brokenness in the system. That it takes a different approach to support these children and youth in a good way. And I really hope that the Ombudsman's investigation highlights the areas that need immediate attention.
Do you think you're going to learn anything new?
Gosh, I don't think we will. I think that we've admired this problem for a long time. And the frustration is there also have been solutions proffered to the ministry, to the government, I should say, around this. And we still don't see those recommendations coming to fruition.
A lot of people in the community say that CAS needs to be overhauled, that it needs to be rethought. Do you agree with that?
I agree that in Ontario, the current iteration of our child protection sector does need some modernization and does need some approaches that are more strength-based, more family-focused, more prevention. We do so much better when we can intervene at the earliest possible stage. We're generally a reactive service, and I think families, when we can intervene at a sooner stage in whatever crisis they're in, the outcomes tend to be much better for them.
And with the financial situation as it is, what happens next? Are more cuts coming? Do you see any way forward?
We are about as lean as we can get and continue to be able to deliver on our mandate. So I'm hopeful that that's not the case. We're working closely with the ministry about our budget. The sector in of itself is well over $100 million in deficit, so it's not unique to Windsor-Essex. I think there is then a call for overhaul in the funding formula that is attributed to child welfare. We hear a lot from the government, we made this investment and that investment. Those investments have not impacted this particular population.
If nothing changes, what does CAS look like a year from now?
Wow, that's a good question. And part of our deficit management planning around this and this excruciating decisions we've had to make are to make ourselves sustainable over time. And if we don't get some support and a change in the system within the government, within our ministry, then certainly there's vulnerabilities all around.
You and I have had conversations about Maryvale and the cottages that are available there. Is that still on the table as a way to help with all of this?
Yeah, we continue to work really closely with community partners like Maryvale to develop some residential options so that we can find more appropriate and licensed spots for children and youth to be cared for. Of course, those aren't going to be at a neutral cost to us, but it'll be certainly more cost effective and much better outcomes than in trying to support children and youth in unlicensed placements. So that continues to be a priority for our organization and I believe Maryvale's, and we continue to work together to try to make this a reality.
Is there a timeline on that?
Gosh, I hope before the summer, but certainly these things often take levels and layers of approvals as well. But my hope is before the summer to get some relief immediately.
And the ideal plan would be before the summer that people who are in the hotels would then be moved to these cottages, and it would sort of give some extra support to your staff because you'd be using Maryvale staff.
Correct. We'd be using an outside paid resource, OPR provider staff, and so a number of the children and youth. Thankfully, right now we've had for a long time 0 children in youth in a hotel, and we have managed to move some children into the cottages that we lease for Maryvale, but the programs themselves are not yet up and running. So we're continuing to staff those children and youth 24/7.
All right. Derek, thanks so much for coming in this morning and sort of clearing the air on some of this.
Thank you. Appreciate you having me.